welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we'll be discussing physician reputation. So be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 13 years of health IT blog content at healthcareittoday.com. This is going to be a fun one. Reputation management is a challenging thing for doctors, so I'm excited to talk about it.
It's definitely challenging, and it's definitely something that keeps them up at night, right? Like one bad review, one bad statement. I mean, I can't fault them because I'm the same way. If I get something someone says about me online, I'm going to react to it. So, but managing your reputation online, not easy as a physician, for sure.
I have to tell this preamble story. So at the Expo.Health conference, one of the CMIOs, I think he's actually CIO, so he sees patients, I think, once a week, right? So, he's mostly CIO, CMIO, but he sees patients once a week. And he said at Expo.Health from the stage, he's like, yeah, my children started searching me online and said, hey, Dad, why are you a 2.7 rating? The kids were searching his profile. He's like, I'm up to a 3.3 now. But it was interesting how even the CIO was interested in his rating, and his kids even started searching it.
Well, that definitely is. I mean, those are funny stories to hear, and it's glad that he took it with a grain of humor there, right? Because someone with a 2.7 rating, he could have reacted really poorly too, but
it's because I'm a 5.0 dad. No, I don't know.
Oh, yeah, I like that. Well done. But no, one of the reasons why we wanted to talk about this, John, was, you mentioned to me earlier this week, just around the fact that they're making available the 2017 MIPS scores now. And so that kind of what precipitated this topic. So I don't know, maybe you want to comment on that?
Yeah, exactly. So you can check out an article we wrote on Healthcare IT Today about these MIPS scores. So it's actually the MIPS scores from 2017, which, may be a point of discussion. Like, wait, it's 2019 and we're just now getting the 2017 scores. And anyways, in the article, we linked to Chirpy Bird Health IT Consulting. They actually created a tool where you could look up anyone's MIPS score. So, of course, my foot's literally in a boot right now from my orthopedic surgeon, so I looked him up, see what his scores were, and he had exceptional ratings, which is great since he's a friend and also my doctor. So that was fun to see. Anyway, it's interesting to think about these MIPS scores and how they could be used, because they are easily searched just by the name of the physician or your group. You can do it by practices. So they release some of the scores by groups, some of them by individual doctors, depending on how they reported. But the question is, are all of the physician rating sites going to start incorporating all these scores? And they're literally called a MIPS quality score. So these rating sites don't have to lie about, like, hey, this is a quality score, even though you and I know that the MIPS score has so little to do with how quality, the quality of care that they provide to patients. So it's a bit of a controversial thing, and they haven't done it yet, although they are publicly available on other sites. But will the mainstream consumer rating sites start incorporating them? If they do, what's it going to mean when you don't have a MIPS score? Or when you said, hey, I just need to do one thing and then I don't get the penalties, and that's fine. So you didn't actually even participate fully in it, but the ratings start saying, oh, your quality scores are low. That could be damaging to a lot of doctors.
Oh, agreed. And I think the way I look at these sites or any measures of quality is that, they do give you an indication of quality, because it's better than nothing. It's better than having, nothing out there.
But if they didn't participate, it's unfair, right?
It is, but I think I agree with you, and I would say it's more of a case of there's no tie to outcome. Like, having a high quality score doesn't mean you're going to have a great outcome as a patient. It might mean in your mind that you might have a more likely outcome of positive outcome, but anybody in the industry will tell you it really doesn't matter the quality. Every patient's unique. Every condition is unique. But I do think, John, I would say I like this development, even if the data is a bit 2 years old, because at least there's some standard. At least there's some formula that people are using to gauge the quality. And sure, right, today, not a lot of people maybe are participating or doing the minimum. But as this does get more into the public realm, now all of a sudden people will definitely care about it, because whether we like it or not, or agree that it's comprehensive or not, people are going to start basing their decisions on it. And as soon as people start basing the decisions, sooner or later, payments are going to be, sorry, you have to have a certain minimum score in order to even qualify in terms of, with certain patients. I'm not going to go to anyone less than this score or that score. I see all of this happening, and I think it's a good thing, because I think it'll lead to refinement of that mechanism.
See, and I think it's a scary thing. Like, it really goes back to this core question, and the core question is, can you measure quality? And I'm still of the opinion that I haven't seen it yet. And I talk to a lot of really smart people that are smarter than me when it comes to quality, and they say, yeah, I think there is a way that you could do it. And they all agree that MIPS wasn't it, but they say, yeah, there is a way to do it. And some people have made the case that the AHA or other organizations like that should really take that as an initiative that they should do, so that we could assess the quality. But my problem with it has always been that even doctors among themselves don't know if another doctor is a quality doctor. They do within their own specialty, but then they would never go to that doctor. So they don't have any way to assess. Even if you're a cardiologist, you can't assess how good the gastroenterologist is necessarily. So it's just such a hard thing to measure. I'm afraid we'll never get there, at least in this current environment, at least in our lifetimes, that we're not going to get there to really rate quality. And so, this is where it's frustrating for me when someone could use a MIPS quality score to assess the quality, and it's not fair.
And you're absolutely right. I'm not judging the whether MIPS is fair or not. But I would argue this same thing has happened in other industries, whether it's the airline industry, the hotel industry, the automobile industry. I mean, who says JD Power is the definitive, quality standard, right? Or should it not be just on number of repairs and dollars of repairs of your cars and how many you have out there? Like, there are multiple ways that people will claim that they have the best quality car. And if you and I even debated quality of car, you and I would come up with different definitions, right? But that doesn't stop.
National differences or just our own?
There's probably some international differences. I'm pretty sure handling in snow is probably not high on your quality list.
Well, I guess and that illustrates the problems so well, right?
It does, and I agree with you in terms of measuring absolute quality in a nice, compact, definable way. I don't think we're going to achieve that. However, like the other industries, it gives you a measure upon which you can do comparison, right? Whether you like JD Power or not, they do have a ranking, and then you can look at that ranking versus other score mechanism ranking versus another score and kind of get an idea of, okay, well, if they scored high on all three, it must be all right? But you're still going to choose this car over that car because of other reasons. It just becomes one thing to factor in your decision. I see there's hope for MIPS scores going that way. I think maybe in the current incarnation, maybe not, but with some refinement, with more participation, with the realization that these are being incorporated into people's decision making, then we might get more work and more effort being put into this area.
Yeah, but it goes back to being so unfair. I mean, back to your example of, snow car versus a desert car is so different. Well, the same is true if you live in a poor area and you have bad health outcomes and you're seeing these really challenging patients who can't invest in their health. They can't get good food. I mean, we know SDOH is such a major contributor to your health, and yet we're going to judge the quality of the doctor on the outcomes they receive if they take care of patients in a poor area versus a middle class area versus a rich area, which probably has opioid crisis problems. I think that's been proven out pretty well. In the richer areas, they have drug problems and other challenging situations. So I don't know. It'll be interesting to see how it goes. And then it will also be interesting to see how do the physician ratings websites really incorporate this into it. Do they choose to embrace MIPS or some other type of quality score? Because I've always said, let's just be realistic about what physician rating sites really are able to do, and they are able to rate the customer service of a healthcare organization, and I'm totally fine with that. I think that's something that's totally reasonable. But my problem has always been that many of the physician rating sites take this review of customer service and they make it appear as if they're providing a patient review of the quality of care that's given. And to me, those are totally different things. And it's unfair when they represent a patient review of customer service as the quality of the doctor.
Yeah, again, I don't argue with you there. I think you're right that the physician rating sites as they're currently constructed do substitute customer service ratings and star ratings for clinical quality ratings, and the two are not the same, and they are not what is being asked of the patient. It's not like the patient sits there and answers questions around, hey, did you have a good outcome? It's just simply a 5-star rating like you rate an Uber ride, right?
And do they even know if they had a good outcome, right? Like, okay,
Exactly.
they were healed, but it took 3 weeks when it should have taken 3 days, and they may not know that, right? So like, it just gets so complex so quickly.
Yeah, and which is why I think a lot of people do kind of look at physician rating sites kind of with a grain of salt. I agree with you though. I think some of the smart ones, anyways, are realizing this, that they are not really measuring outcomes or clinical quality, and so I think they are going to have to find other ways to add more data into their pool, right? Whether that data is like the MIPS data that you're talking about, it could be other demographic data. Like I can totally see a site doing what you just mentioned, John, where, hey, let's take the MIPS quality scores and from the public website, let's take some demographic information of the catchment area of this physician, let's put that together and go, hey, you know what? This physician is practicing in a zone that's, like this and has some difficulty and some challenges. So their score relative to other ones in that same zone actually pretty good, right? Even
And they could
though
even compare it against other comparable
exactly,
zones that are challenging, maybe across the country. Or yeah, that would be interesting.
exactly. Because I think that's where some smart sites can go to say, okay, you know what? We can't rate everyone on an absolute scale because you can't compare somebody in downtown Los Angeles to someone in the rural areas. So let's find ways to allow you to do that, right? So you can make the judgment yourself. So I do see some of these rating sites getting more advanced and incorporating more data sources, and I'm thankful that a lot of the pub are now kind of available online to allow them to actually do this.
Yeah, and what's interesting is if you look at those two factors, right? Uh, Bedside manner, let's call it that, right? Like, what's the customer service, bedside manner of the doctor, of the front desk, of all those things, right? How is the customer service elements? And then you do the quality of care. If you were to ask me, would you go to a doctor who has terrible bedside manner but has the highest quality of care, is going to keep you healthy and avoid sicknesses? And I think for most people, they would say, I want the highest quality of care, even if their bedside manner isn't so good, and even if I have to wait an extra hour, but I know I'm going to get better outcomes, they probably are going to take the person with better outcomes, which is really interesting when you think about how do we measure, do they have better outcomes?
Well, yeah, but I think just to your point, I think it depends on why you're seeing that physician, right? It like if I have a chronic condition, if it's a life and death situation, you're absolutely right. I don't think bedside manner is going to factor into most people's decisions. However, if it's more common problems, I have a headache, I don't know really, I just need, a renewal of prescription, then the scale tips maybe the other way. I'm going, well, do I really care that this person has higher outcomes for people who have migraines versus, the better customer service, but I don't have to wait. I can do everything online. He's got or she's got, ability to communicate with me in an asynchronous manner. It can tip the balances to where you might actually consider those. So I do think that it's a bit of a balance that I think it depends on the situation. Sorry, and therefore I think smart physician rating sites should allow for this kind of slicing, or at least this kind of presentation, so that you can make some of these decisions.
It's fascinating what you're saying, because what you're suggesting is that If it's something where there's a high risk of an adverse outcome, then I care,
Right.
right? But pretty much every doctor can treat the flu, right? Or the cold.
Right.
So, maybe that's where we need the data. And, maybe these rating sites need to incorporate what is your chief complaint and
Right.
what's the risk of that chief complaint being misdiagnosed or incorrectly diagnosed. And that will influence whether we care about the quality because, probably, for a cold or flu, you get 99% the same outcome with pretty much every doctor. And so, yeah, I don't really care. Then bedside manner and customer service really matters because I know the outcome is going to be the same. But if I'm dealing with a chronic condition that has very different outcomes based on the quality of the doctor that's there, the way they treat it, the tools they provide, et cetera, that might really influence that. That's really a fascinating way. And none of them are that sophisticated,
No.
unfortunately.
No, but I think again, using that example, I think that's the difference between, am I looking for a luxury or sports car, or am I looking for a family car? Sites do start that way before they get into making recommendations for you and ratings. Because why, Mercedes-Benz may have the highest rating, but it's not affordable to me, and that's not what I want, right? Like I don't care about the top quality if I just need a cargo thing to get me from A to B. But anyway, yeah, it's just kind of interesting to think about rating sites. Of course, very controversial as well. Physicians love and have love-hate relationships with them, but that's something we'll discuss next. And by the way, hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. And this week we're talking about physician reputation, a hot topic that is coming about because of the 2017 MIPS scores that are being made available publicly. So John, let's change gears a little bit and talk about the role that technology can play in managing or improving a physician's reputation.
So, there's so many angles to technology because, interestingly enough, the reason we have all these rating websites is because of technology. Like, how did the ratings happen back in the olden days? I guess the payers collected them, maybe, and maybe you had some ratings. Like, technology made it possible to even evaluate and even discover new opportunities. And then, air travel has provided incredible opportunities where, maybe I should go to Las Vegas for my for my gastric bypass surgery because they have the highest quality and I get to relax in a nice place. So it's interesting that, but more specifically to the ratings websites is, I love the idea of using technology to engage your patients is going to be key. So if you want to be successful on a ratings website, you need the 75% of patients who aren't going to go do the physician rating. You need them to get involved because we already know the ones that are pissed off and angry and had a bad experience, they're going to use the ratings websites. And we know that 5% that just had an extraordinary experience, you cured their cancer, whatever it might be, right? They just had this amazing experience, they're going to use it as well. So how do you do that 75%, and maybe it's more like 95% of patients who aren't going to go there on their own, but would go there if they just had a little encouragement? That's where I think technology can play an incredible role. And I've seen it over and over in practices and hospitals that if you use the right technology, and often it's something as simple as a text message or an email that's framed the right way, you can encourage those that 95% of people who aren't going to rate to just take a minute and go ahead and rate you. And so if you do that, that's half of the battle, maybe even more.
I think I could take a slightly different approach to the use of technology. I look at this as, an opportunity, maybe a wake-up call for some, to actually use technology in their practices and in their organizations to engage with the patients on that customer service level. And here on what I'm talking about is, the ability to book appointment online, the ability to see a wait time on an app, the ability not to have to actually wait in your waiting room and have you text me when I need to go back, right? And so I can go and wander around the mall that you're in or the area that you're in after checking in. I want to be able to check in online. And all these things that, again, we've been, you mentioned it, we've been accustomed to in other industries. I totally see that playing a role on rating sites for sure, and a little bit in terms of the the perception of quality. I mean, there's been a lot of studies that have looked at the correlation between a perception of quality and customer service. And that actually does have a role in outcome. If you believe you had a good quality encounter, your outcomes, you will be better because you believe it to be so. So I look at this as, if you're thinking about or concerned about ratings, if you're concerned about just being a good practice or a good physician, you've got to look at technology and the effect it can have on the service that you're providing. And it can be as simple as, like you said, texting, offering the ability for you to text with a patient or to get a text reminder, or simply a reminder of, text reminder of your upcoming appointment, instructions that are delivered via email. Even if you don't communicate via email in terms of, allowing a patient to connect with you that way, at least being able to use that mechanism and using some of these modern tools, I think plays a big role.
That's a good point. I mean, I'm supposed to go get a lab test done, and I'm surprised that I haven't got a text message or email saying, why haven't you gone and done it? I kind of almost expect it, and I haven't gotten it, which is interesting. I was working on this challenge with Shahid Shah one day, and we kind of said, well, okay, we can't put on a ratings website a quality measure, because how do we measure quality? But could the use of technology be a faux measure of quality? The idea being, and I'm interested to see if you agree or disagree with this, if you are staying up to date on the latest technology, does that mean that your organization is staying up to date on the latest advances in medicine and the latest technologies available for treatment and all of those things? Like, is it a faux measure of, if I stay up to date with the latest technology for my practice and I provide online self-scheduling and, a nice updated website, etc., is that a faux measure of how the kind of quality care that I'm providing? Because if I keep up to date on that technology, I'm probably keeping up to date in other areas. And maybe, I mean, anyways, let's have your answer, then I'll see.
That's an interesting thought. So is one a surrogate? I call it a surrogate measure. You call it a faux measure, but it's the same thing. I would say I think there's some truth to that. That if it's the same theory as, is your place clean, right? If as a place of business, do you keep it up to date? Do you keep it nice and tidy? That shows you care about it. At the very least, that goes, if you show that much care about the appearance of your place of work, that must mean you care a little bit about the quality of work that you're providing. So I think in that spirit, it is a surrogate for, that if you are using these advanced technologies to engage your patients in this way, it does give a little bit of indication that, hey, you're probably up to speed on the latest technologies and things in the clinical side of your practice as well.
Yeah, well, and what's interesting is we all know that you don't have to have online self-scheduling to provide an amazing in-room patient experience, sure, right? Like that's clear, right? But what's interesting is from a perception standpoint, which in some ways is all that matters, does it create the perception that you are even if you're not? And that could be an exciting thing for those that stay up to date on technology, and could be a scary thing for those who use it inappropriately and provide a bad experience for a patient and don't provide quality care. But anyway, I mean, it's interesting to think about the perception, going back to what you said, that patients have, that, hey, this was an amazing experience and I loved it, even if the quality of the care wasn't as good as the quality of the customer service. But right, technology can certainly change that experience.
Hey John, if you can believe it, we're getting close to the end of the episode here. So one quick tweet size tip for how you can improve or manage your reputation online as a physician.
Yeah, so my tip is, when you get a bad review, engage with the bad review. Don't just avoid it. Engage and show them that, hey, what this review doesn't mean we don't care. Because if you engage with them and show that you care, it'll turn a bad review into a good one.
And my tip around this area would be, own your own reputation by being online. And that can mean social media, but it can also mean articles. It can also mean engaging in person in your community. Because when you put yourself out there and show the real self, when those bad reviews do come, when those adversities do come, you've at least established that, hey, you're already out there. This is not you. This is an apparition.
Nice.
Whereas if you don't do any of that, and then that one bad, review hits, that may be the only thing online about you, and that's not what you want. So get ahead of it by being out there and being online.
I think that's a future topic, healthcare social media. I think
there you go. Hey, listen, to all of you, thank you for tuning into this episode of Healthcare IT Today. You can find more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and your comments with us at healthcareittoday.com or on Twitter using the hashtag HITSM. I'm Colin Hung with my friend and health IT collaborator, John Lynn. Thanks for listening and have a great week.